So what choice we have? We have all know burr-based, saw-based, fully automated, robotic assisted. Now I have a saw-based, which is Willis. Now everyone has, when they're successful, they have itch. But no surgeon has a 7 or 10 year itch to change their environment. Surgeons believe that they should have the same environment, unlike their other part of their personality. So adapting to new technology for every surgeon, what surgeon wants, minimum change in ecosystem, few changes in his working pattern, minimum instrumental changes, similar feel of tissue and the bone cuts, and time neutral. So that's what a surgeon desires when he changes to a new technology. Now we have two choices when to operate. Either you have a saw-based or a burr-based. Now if you have done more than 10,000 or thousands of knees in my life, and I have held saws all my surgeries. So everyone has seen a saw as their foundation of a basic joint replacement all their lives, whether they are 5, 10, 15, 20 years of your life. Burr, I always think, what is burr? It's not something which I desire to operate a knee in, because you have never been tuned to operate with a burr. Why no burr? I think Dr. Krishna Kiran made my talk very easy when he showed, when he was doing all burr, he went into saw system. So ortho surgeons are impatient and can't waste time on burring. It's a tedious job with a burr led to distal burr technique. So distal burr technique itself shows they are afraid of a burr. And they want only 2 holes and then the rest of things with the saw. It's an indirect confirmation of how the boning is to burr the sclerotic bones. Thermal necrosis is more so, constant irrigation is also a trouble. It's not ergonomically sound also. So a lot of people have carpal tunnels and everything. So you can't buy a system, have a trouble and pay for it. So it's a non-macro thing, mature thing. So I suppose it's like drawing on a thing. So foundation has not changed because I have shifted to robotics. So my foundation is same. My brain always works with a saw and this still works with a saw. So advantage of Willis, saw does not change the plane if it's forced. So even if a leg moves or robotic arm adjusts itself in the real plane and still continues the same plane. I control the saw. I don't require haptic boundaries because I know how much to go in for. After years of experience, everyone here in the room knows when to stop when you're using a saw. So it's not like you can go blindly and get into soft tissues. That's not the right thing. So here if I have 2 saws, I have my standard striker and the Willis, both feel similar in my hand. The conventional shows that it's more accurate to have a saw system. And if you see these operating photographs of mine here, sorry, okay. Is it not pointer? Okay. So the saw system, the ecosystem in my theater remain the same. I use similar saws, my hands are perfectly balanced in the saw, assistants are there, there's nothing else coming in between. And the feel is exactly the same what I feel for normal things before the robotics, like navigation or non-navigation, whatever it may be. The cuts, if you see the cuts, they're extremely accurate, they're quick and fast. In the morning in surgery, you can see within a matter of a couple of minutes, it's all done. It's no way you can spend time on that and continue to do surgery for hours or maybe a few minutes more. Here, after proper cuts, and you get a proper alignment, which gives you a perfect looking graph in all directions of the range. So when you do a perfect cut with robotic saw, what you get is a feel what you had for years of perfect looking bone with a perfect saw cuts that too quick and absolutely accurate. So after 550 cases in my setup, average time for all cuts is less than 2 minutes. Average time for removal of tunica or robot is 17 to 20 minutes. Average for tunica time is 38 minutes. So if you see all those things put together with a saw-based system, we can do every difficult case. So that's it. Is it 1 minute left? Okay. So few cases, few examples, bagged deformities, both planes. Again, robotics, both needs to simultaneously done. Again, a very hefty patient with a poor range of motion, pre-op, post-op, instead arthritis, 20 degrees of varus deformity corrected to 1 degree with perfect alignment in the balance you can see there. Post-ops, windswept deformity, varus and valgus, both knees, 4 degrees and of varus, 15 degrees of valgus, corrected to perfect alignment. That's the post-op X-rays. Instead arthritis, very obese patient, range of motion, 20 degrees of varus. Again, back to 1 degree and 5 degrees flexion, good alignment in all planes, and that's a post-op X-ray. Again, a very difficult patient with a poor range of motion and an implant, we could get away with a VELIS without removing the implant and putting things on with a saw-based system. So all put together is one of the excellent systems to have. Thank you.